Hi, everyone. Welcome to this week's panel discussion in honor of Women in Medicine Month. Today's discussion is going to focus on balancing work and family, which, may or may not be a true balance for many of us. I am Andrea Russo. I'm Director of the Electrophysiology and Arrhythmia Services at Cooper Hospital, and I'll be moderating the session this morning. I'm really honored to be joined by 5 distinguished and diverse panelists representing a variety of different fields and backgrounds at different stages of training or practice. Our first panelist is Dr. Joanne Mazzarelli. She's Assistant Professor of Medicine at Cooper Medical School of Rowan University and Director of the Cardio-Oncology Program at MD Anderson Cancer Center at Cooper University Healthcare. And she's also the incoming Program Director of the Cardiovascular Fellowship Program. There's Dr. Meena Khandelwal, who's Professor of Obstetrics and Gynecology in the Division of Maternal Fetal Medicine at Cooper Medical School of Rowan University. And she's also Director of Research and Grand Rounds in her department, as well as Course Director for Week on the Wards for the M1 and M1 students at Cooper Medical School. Dr. Maurizio Cotto is Assistant Professor of Medicine and Director of Echocardiography and also co-director of the Cardio-Oncology Program. We have Dr. Nika Filatova, who's a third-year medicine resident at Cooper Hospital, and Dr. Lisa Reed, who is Associate Professor of Surgery and Endocrine Surgeon at Cooper Hospital. So I'd like to thank everyone in advance for your willingness to share your experiences so we can all learn from everyone today. Thank you for joining. So what we'll do is I'll start out with a series of questions for our panelists, which will include a discussion, and one or more panelists may decide to respond to each question. People can add some questions to the chat as we go along, and we can address those at the end. And I'll start out with just a general question really for the group. What are some of the challenges that you face at home in terms of your family and childcare responsibilities, and how do you juggle this from between work and family with all of these challenges? And let me start out with our trainee, our resident view from Nika. Why don't you start us off?
Sure. Yeah. I have a 2-year-old at home. I actually had him about a month before I started a residency. So that was definitely a challenge. I think we had been talking about how medicine in all levels is never a 9-to-5 job. It's always, you never know when you're going to be home. You never know when you're going to be able to sort of, make it in time. So I relied a lot on, I was lucky enough that I had a lot of family support. My husband's not in medicine, so he was able to help out in that sense. But I think from my end, it's just a lot of pre-planning for the silliest of things like dinner and laundry and all these things that maybe other people don't have to necessarily plan to do. But, I sort of very much do have to plan to do them and then kind of think ahead and try to sort of juggle the two the best that I can. But doesn't always work out perfectly. So.
Yeah, certainly a challenging timing of things, starting a lot of new things, starting a new family, starting a new, position, but, it's pretty amazing and interested. So we have, different stages, people are at different stages of their career. So Dr. Cotto, you've been established in practice for a while. Can you tell us a little bit about your experiences?
Good morning. My experiences are very similar to Nika's. My only difference is that I'm a single mom, and I do not have a support system in Southern New Jersey. My mother lives in New York City, so she's far away. She's in her 80s. So I rely heavily on myself and nannies, pretty much. Earlier, when my daughter was smaller, I had au pairs. In the beginning, it worked out pretty well, but then towards the end, it was a little challenging. And now I have local people. So it's a lot of coordination, as Nika mentioned, with the smallest of things. It's a lot of pre-planning and ever-expanding to-do lists. But I'm really lucky, I think, because I have a good support system. Believe it, at work, people have adjusted to my schedule a little bit, like when I had to be the person to drop off, and my colleagues have been amazing. So I think that without that sort of support, it would be pretty challenging. I have to say that my daughter's now 10, and I've only had to leave work just a week ago for a couple of hours since I had her, because I didn't have support. I couldn't get together. So it's worked out. I've been incredibly, I think I've been blessed mostly.
So that's, in two different periods of, having children, is different challenges early on, versus, after your career is established. So it takes a team, a team at home, or sometimes an army at home for support, as well as, understanding and colleagues and work colleagues, to help with that. So those are great. Thank you for sharing those experiences. And then I always wonder too, we all pick certain career choices. And, I guess, do we look at certain specialties, and some represented on the phone today, where there may be fewer women and maybe fewer role models in those fields, but did your plans or your future plans in terms of, deciding if you're going to start a family or have children in your family, did you select, or did that have any impact on your selection of your specialty or subspecialty, in medicine or surgery? And, we get some few different perspectives on this, but Joanne, why don't you start us out with medicine, cardiology, and your perspectives?
Sure. When you decide you want to do a subspecialty, you're really thinking 6 years in advance. So it's hard. I can look back now and say, well, I don't really think that my decision to go into cardiology, I don't think I thought heavily about having children when I was, say a fourth year medical student and I was going to the match. And at the time I decided, I'm going to pick the subject matter and the specialty that I think is going to make me happy, right? Because I certainly didn't want to be stuck in a position where I was unhappy, but a mother, and now I'm kind of bringing that unhappiness home with me, So I do believe that when you pick your specialty, you have to pick something that you think is going to be, and nothing's perfect, right? We all find flaws within our own specialty and so on and so forth. You have to choose your happiness, right? You have to put yourself first and say, this is what I want to do. That being said, cardiology is fairly competitive. When you're applying for fellowship, I did have to make some decisions about, where I would apply and things like that. And I geographically restricted myself, but I don't think that handicapped me in any way. It's probably the other way around, that you delay you delay having children. And sometimes I regret that. And other times I think, well, that's just sort of like a bias looking back. Because everything worked out, right? I'm happy. I have my, all my children, and life is good. But I do think, yes, it plays in. I like to think that I didn't choose my specialty based on whether or not I'd be a mother, but probably subconsciously many choices were influenced by that. And certainly the decision to delay being a mother was influenced by that.
Yeah, no, that's great. Great advice. So do what you love, and then kind of figure out.
You kind of figure it out, right? So you have to be very resilient, very flexible, and you have to be willing to ask for help. And I think I got to say, my husband was really good at reminding me, like, you just have to ask for help. We have a hard time doing that. And if you decide, hey, I want to do cardiology, which some women go on to do interventional, EP, things like that, which may be even more demanding. But as long as you're, willing to admit that you need help along the way, then, you should go for what you think you love.
Yeah. And it's great to have, role models like you, women on this call, especially in, fields that are underrepresented, perhaps, like cardiology with women. And also, Lisa, so surgery, what were your experiences, like, or what made, in terms of your decisions, you're in a field probably also underrepresented by women. So what are your thoughts in your selections?
Yeah, actually, of what Joanne said, I actually did not think about children when I was a fourth year medical school student deciding to go into surgery. It was actually the last thing on my mind, to be honest with you. But I did realize pretty quickly into surgery residency that having children was frowned on. We were quite in the minority as women in the program, and the one female resident that had a child really faced a lot of challenges and was treated, to be quite honest, very poorly by her colleagues. And it actually made me then decide to wait. So it did actually influenced my decision. And that made me think, well, there's no way I'm having a child in residency. So I did wait. And yes, I had children later in life at advanced maternal age. And there's actually been a lot of data now out on surgery residents and other residents who've waited, women in medicine in general, who've waited to have children, that they actually have a much harder time, that, ability to conceive and the rates of miscarriage is much higher. But a lot of us do wait and have this delayed entry into motherhood, which comes with its challenges, but also comes with its advantages. So I wasn't a resident anymore. My schedule was a little bit more to my making, so that made things easier. But certainly the same things apply. I still need a support system, someone who's there, or some people, more than one usually, to help you on the days when you're on call or when you have long days, or my children have things after school that I'm not able to take them to. And planning. Like, I literally plan out my whole week, sometimes even longer. Sometimes vacations take months ahead, in advance planning to decide, okay, kids are off this week. I should plan my vacation around the same time and coordinate with my husband. So it definitely, in surgery made me think to wait. I will say that surgery has changed. And that we, even at Cooper, have about half our residents are women. And now we've had several female residents who've had children and have been supported. So I'm glad to say things have progressed. We're not perfect yet, but we've definitely made progress.
Well, that's wonderful. Thank you for all these initial efforts. Can't be easy early on, but certainly also bringing up really some advantages of resources and scheduling and maybe even financial resources for help for childcare. I'd imagine. Great, awesome. And so Nika, you shared a little bit about your perspective already. Did that impact in any way on your decision to go into medicine, or whether or not you'll do a subspecialty in medicine?
Yeah, so I mean, I really, also echoed what Dr. Mazzarelli said. I think priorities end up a little bit split up. I mean, I certainly want to do what makes me happy, and I think in the long run, I think that's really important. So for me, in terms of deciding whether I want to do fellowship, I absolutely do. I decided I did want to do fellowship. Where the impact my family has is that I'm probably taking, some time off after, finishing residency, and, I'm going to work for a little bit and maybe establish myself a little bit and kind of stabilize on that front after sort of 3 years of residency, and then go on and do like my fellowship plan. So it didn't sort of deter me, but it took some consideration and, talking with my husband. And so, there's going to be a little bit of time in between. So in that sense, it did impact it a little bit. But I think it's really important. I think it's important to think long term and to remember that in the end, it's you going to work every day. So you better like it.
Right. No, awesome. Right. And there are lots of options and paths to take. And I think we've seen that from everyone's, discussion so far. Thank you. So, there's, we choose plans and we try to, start children and, have a family at a certain point in time. I guess, is there an ideal time, and or how did you decide on those times, or maybe there wasn't a decision, things just kind of happen, and were there, are there certain policies or procedures that are in place with different hospitals or programs to help with this? And I'd be interested also to hear, so Mina, your career focuses on childbirth and that's a focus of what you do every day. I'm interested to hear, is where OB is. Are you ahead of the game, or what are some of the things going on that went on in your mind and also that goes on in your field?
Thank you, Andrea. I want to say that I think I'm the oldest on the panel, and so I have grown-up kids, and 2 of my daughters are married. So I'll tell you, when I had my kids, I was an internal medicine resident, and we had no such thing as maternity leave at that time. for breast pumps or breast pump rooms or anything. So I had to take my vacation as maternity leave. And when I came back, I had to make up all my calls. And so after a month, when I came back, I was on call every other day. And I was trying to breastfeed at the same time. And actually, a few times I fell asleep on the wheel because either I was working or I was pumping. And so I had to give up breastfeeding because I had no support at that time. And there are very few. And after internal medicine, actually, I switched. I did have a lot of family support. I have a mother-in-law, I had a 24/7 nanny at home. And I switched actually to obstetrics and gynecology. And this I'm talking about 15, 20 years ago. I was constantly taunted on at work that, that I had a child, which no other resident had, and that having a child was somehow I was going to make the other residents work harder. So it was actually my peers, not even my peers, who were afraid that because I had children, I would make them work harder or I would take time off. Thankfully, that never happened. However, it made a very uncomfortable feeling. But I'll tell you, something wonderful happened. And as I was graduating from my residency, I saw I could also be a role model to other women who started having children during their residency program, at least towards the end. So in their 4th years, they started having children. And now I can say in obstetrics and gynecology, where majority of our residents are women, they have children. We see residents breast pumping in the rooms, while they're working. We all, 50%, many of our residents get married during residency, have children during residency. So our field has come a long way, and it's a real pleasure to see that. And I'm a strong support of women having children when they want to have them and not to have to wait for their career and to be able to even breastfeed and enjoy their families while working.
Well, that's fabulous. I mean, I think the role model that you've created, so someone has to start this, and so it's great to hear that more and more women are considering this. I think programs like this today, hearing voices from women in all different areas is really, I hope will help others make some of the right decisions, for them. Thank you. Maritza, just in terms of ideal times, and how did you decide? You decided, I think, a little bit later than Mina to have a family or to start with children. What were your thoughts, or what went through your mind?
I did approach the delayed, waiting till later. I think mostly because I was still single. And then ultimately decided that I didn't want to wait anymore, that being a mother was as important to me as being a physician. And so after trying a lot of GYN approaches to conceiving, I ultimately adopted my daughter and waited a long time. I always tell her that she's my gift from God because I waited 5 years for her to come through. And it was like an unbelievable match. So I was 52 when my daughter was born. And it was the best, one of the best days of my life. I mean, equal to, the white coat ceremony. When you get your white coat for the first time, it was one of those feelings. It was amazing. And it has been, oh, there she is. She's, go sit down, honey. Go sit down.
That's wonderful.
So, it was a definite delay. And in response to a previous question, when I decided to go into cardiology, I wanted to do interventional. And at that point in time, I did think about it because it was early in the interventional program. At that time, they didn't have fellowships. It was like word of mouth how you got a position. And so I made a distinct decision not to do interventional at that time because of the hours and inability to be home with your family, because I was still thinking I would like to have a family at that time. So I did change my course. So I guess I'm in a barren sea. I'm not doing it the way most people do it.
No, I think this is perfect. I think everyone, this shows, I mean, we have, people who had children, right, or before residency, And then there's just so many options, and there are so many choices, and there are different choices we make along the way. And there's no right or wrong. I mean, it's fabulous. And, being an older parent, I'm in the same boat there as, it's just, a blessing at any point in time. But there are choices, and not the same thing isn't right for everyone, but just, I think, to share these experiences helps everyone. Thank you. And then we do have, some specialties that are underrepresented by women. And, I'm going to actually just point this to Lisa first, but, what was it like? I mean, really, if you're a, a single woman, you described a little bit of that, what is it like to feel like a minority in the group, and talking about families and children and policies? Are there things in place, or things that made it easier or made it more difficult to allow family responsibilities to occur?
Yeah, so I will say that there was a lot of difficulty in getting, support, in the sense that I didn't have anyone to ask. There's no one else in surgery I could say, how did you deal with having children? How did you figure out, your time off? In fact, I found out after I had to figure out maternity leave that no one else in my department had ever done that before. Like, no other women of childbearing age had asked for maternity leave, and I had to figure it out with HR how that was done. Like, it was actually a novel thing. But fortunately, hopefully, that my learning that has helped subsequent women. But that was a surprising thing to me, that was still something new, and I would have been the first one. So that was hard. And when I was breastfeeding, I had a little sign on my door, and I was very clear, this is time for me. And there's a little lactating sign on the door that this is my time for pumping. And everyone respected it, probably because they were afraid of the sign and didn't know what to do. But it worked for me. But it was hard not to have, I didn't know who to ask. I was asking all the other women in other specialties, how do you pump? Like, I didn't know where to pump in between surgeries. Like, I had to figure that out. I had this whole system down, because it's kind of hard to get to that lactation room. And I would actually, pump in the locker room sometimes, which sounds weird, but it was better than the bathroom. But you'd be surprised by how many women would ask me, what are you doing? Why are you doing that in here? I was actually very surprised by that. Or what is that thing under your shirt? So definitely an interesting situation to be in, and not very many people around me who could relate. But fortunately, there were other women in other specialties who were very supportive and were able to help me out. But yeah, sometimes you find yourself alone, and you have to kind of figure these things out. But it's good to have other women supporting you.
Oh, that's great. No, thank you for sharing that. And it's definitely difficult to be the first one, along the way doing this. Must have been hard. Thank you. So, just switching gears a little bit. So, we've, some people, you decide to have a family at different stages of your career. And do you feel that having children at whatever point that may be has impacted on career development and promotion? If so, how did it do that? And looking back, would you do anything differently, I guess, and for lessons learned? Let me start with Joanne. What are your thoughts?
So the short answer is yes, it definitely did. And I don't mean to say that there were some specific incidents where there were me against some other candidate in similarly situated but had no children, and they said, let's go with the no children person. I don't mean it in that way, but if you think about it, so I had 4 children over the course of 4.5 years. I'm sorry, 5.5 years. And so for each child, I took 3 months of maternity leave. One of them I did 6 weeks. But overall, over the course of 5.5 years, it was just under a year that I was not physically present in my department. So just by my absence alone, I have to assume that I missed out on certain opportunities, certain networking, meetings. If we're having a faculty, meeting and they're talking about developing a new program and you're just not there, right? So So and if you compare that to our male counterparts, meaning dads, over the course of 5.5, 6 years, they would have had roughly a month away, right? Because they take about a week or so, maybe 2 weeks of paternity. But that's a year versus a month for our male counterparts who are fathers. So I would be naive to assume that that didn't have some impact. And then you kind of ravel that in with the aftermath, right? So you take the 3 months where you're physically with your child, but then some of us continue to breastfeed. That's a decision that we made. It's very personal. And we are still parenting, right? And in my case, I had several children under the age of like 5 at one time. And there's a whole parenting aspect. And I can't speak for every mother out there or every relationship, but there's this thing called the default parent, right? Where the children generally rely on one versus the other. And the classic example is when the father's standing in front of the refrigerator holding a thing of water, and the child walks upstairs to the mother who's in the bathroom and says, "Can you get me a glass of water?" Like there is this thing where the mom, again, I want to be very clear. I'm not speaking for all mothers or all relationships or all family situations. And then there's single parents, who don't even, may not have someone else there, but you become the default parent sometimes as the woman. And in that instance, I have to assume that also could have impacted, right? There's this whole idea that women have trouble networking in some specialties. Cardiology happens to be one of them. I think we've made a great improvement. But being able to network, just getting yourself out there, not having to worry about these other ginormous obligations. Is there a specific incident? No, but yes, it did impact. Yeah. I mean, I eventually got to where I wanted to be, but it took me much longer probably than other people.
Yeah, that's a really interesting perspective. Never even thought of that, counting up the time and the months. I mean, certainly having worked with you, you didn't miss a beat from my standpoint. I just never even noticed all that. But, that's incredible perspective. Thank you. So, Mina, as a more senior, woman and in your career, did you think that had any impact at all, or was it a different experience?
I think I would be naive to say if it didn't have an impact. I think Joanne is absolutely right. I can recall an incident when my daughter was sick at work, in the school, and I was actually in the operating room. And they called me as a default parent. They called the mother that your daughter is sick and you need to pick her up from school. And I had a nurse who was answering the phone. I had them say, "Please, can you call my husband because I cannot go?" And of course, my husband promptly told him he was with patients to call me back. And so, it's just, I had to, call him and say, "I'm in the OR, I can't." It was like, you had to come out somehow. Mothers always, I agree with Joanne, becomes a default parent. The other thing is sometimes you have to move around to advance in careers, right? If you have a department where you have settled department heads and there's no vacancy, a lot of advancement in career occurs by moving around. When you're a mother, and it just doesn't happen because you have a husband who settled in his career, you have kids settled in their school. If you uproot them, they get upset. That also hampers your movement around. I also remember clearly when I was a fellow, I had a co-male fellow whose wife had a child, and I would joke around with him and I say, "I need a wife." All the time because I couldn't spend the hours in research at work because I had to go pick up my kids from school or I had to take them to their activities. So I couldn't spend the time in the lab that he could. And I just said to myself at that point, I have to decide what my priorities. And I decided my priorities were to my family and my kids. Until this day, that priority hasn't changed. Work is a priority to me, but my family always comes first. And I can proudly say that makes me really, really happy because my children are very well settled. And 2 of them are married and I have a grandchild. And I think, everybody has to figure out their priorities.
Yeah, no, that's great. That's a great advice and great comments, and it's really that's what it comes down to. What makes you personally happy, your career and your family are are important parts of who we are. Thank you. So along those lines of career, so do you think? So when we're talking about at work, are there any? Have you found any difficulties being a woman? Any thoughts of whether or not finding mentorship or sponsors for career advancement, has it been any different than you think your male colleagues? And if so, how did you navigate this, or who were role models, or who did you reach out to? Let me just start with Joanne, please.
I think that if you're proactive enough and you're assertive, you can definitely find great mentors. And sometimes that's going to be outside of your own department. I mean, two of my mentors were men. One was within cardiology and the other one was outside of cardiology. He was a liver specialist when I was a resident. And so I think, though, that sometimes we don't always recognize, we develop a mentor-mentee relationship and we don't always recognize that it's not working. And that may be because sometimes as women, we find people who are not exactly similar to us, right? So I do think that idea of finding someone who can relate to your personal life helps. It's not essential, but it may help a woman who's in a vulnerable time in their career planning, maybe while they're thinking about families or they have a newborn or things like that. And it may be harder to find people who are like us, who have a similar life. But I mean, generally speaking, I think you have to be pretty assertive. You really have to search out mentors, and that's not gender specific, right? That's all about being proactive, and you can do that. I do think it's different than sponsorship, which ACC talks a lot about. The American College of Cardiology has some focus on that. Sponsorship is when you find someone who's a junior faculty member and you really try to promote them, kind of push them more into maybe the national arena, or you say, like you, Dr. Russo, you're the past president of the Heart Rhythm Society, right? If you decided, you said, well, I'm going to give one of my fellows the opportunity to come talk at one of our national meetings. That's sponsorship. That might be harder for women. And it goes back to the last question, which was, you just may not be as present, maybe because you're on maternity leave, and things like that. Like your presence might be less felt within your department sometimes. And I'm not opening a discussion about whether that's right or wrong or moral or ethical, but the bottom line is that's the reality of how it is. So overall, I think finding a mentor is not challenging, but maybe progressing in that mentor relationship could be a challenge if the mentor doesn't, you're not comfortable. I think women traditionally aren't always comfortable saying, well, yes, I want to do this research project with you, but my time is so limited right now. I have a 2-year-old and a 3-month-old. They're not going to say that necessarily to their mentor unless they really have that comfort level. So
great point. So it doesn't have to be someone in your own department. It doesn't even necessarily be someone at your own center. You may, reach out and relate to someone outside your center. And it's not just the mentorship, it's the next step. Because if we think about it, the guys go out and play golf, or they go to some game and they socialize and they meet people. And sometimes it's during those social interactions, obviously during non-COVID times particularly, but in terms of getting to the next step, someone has to kind of recommend you for something. Then you have to prove yourself once you're recommended. But until you get to that stage, you need someone to sponsor you in addition to mentorship. No, just great points. Lisa, also, because you're also in an area that maybe, initially in your career didn't have a lot of women, what did you do in terms of your advancement, and was that impacted at all?
Yeah, Joanne made very good points about the difference between, sponsorship and mentors. And it can be very hard to find someone that looks like you and, understands what you go through as a mom and as a physician. But I have found there have been many male colleagues and who have served as mentors, and actually were very instrumental in advising me and helping me with promotion and progressing in my career. And I had to be careful to remember that these people are looking out for me, and that my mentors didn't have to look like me. And like Joanne said, they can be even not just in your specialty, but even remote. My fellowship director is probably someone who I've been in contact with more than anything else, who's been very supportive, and it's always the one who said, well, do you have time to write a chapter? Would you want to work with me? How's your schedule this year? One time he called me and said, do you want to go to Kenya, on a trip with me, like goodness, I'm looking the word, to
medical
do
mission.
A mission. Thank you. And I said, well, that would be great, but I'm kind of 6 months pregnant now. Can we do it next year? And he was very understanding. But he's always been the person who I can call, and he's like, where are you academically? What are you doing? So I really appreciate that. Yes, trying to talk about children and balancing motherhood and schedules has been challenging, with male colleagues, but I do think that they can be very supportive and have been very supportive in helping me along with progress in my career. So you have to be open to that, and not limit yourself, because it will be very hard to find someone that looks like you oftentimes.
And it's you bring up also, and I think, do you have time to do something, or you're what you say yes to, you want to be able to follow up on it. It made me think of when I was out on maternity leave. I have 6 weeks. That's going to be so great. I'm going to write 3 papers, and I never had that time off. Little did I was completely clueless. Obviously, did I realize that that's really not vacation. That's not time to catch up on things and to have your family. So, I do have, one more question, but I want to see, I some questions from the audience. I guess I can't see them directly, but, someone was asking a question about, would you do anything different now? Is there something you would point to and say, hey, I would have done this differently than I did initially? Anyone think that would be either you do things the same, or you would change certain things from lessons learned over time?
This is tough to answer because there's so much, we look back with such a different perspective than what we had looking forward. So my answer is not really. I mean, I think you have to kind of just walk through the struggle of being a mother, being a new faculty member, whatever your situation is, sort of simultaneously managing it and having a little bit and being incredibly flexible and resilient. I don't think I would have done anything different. I mean, there's also the whole idea of like, do we treat mothers fairly in terms of maternity leave and things like that? Would I advocated, but for myself better? But I think probably I made the best decisions I could with the tools I had. And I don't see a whole lot of utility at looking back with regret. So.
Yeah, no, that's great. And just making it work and what you have on hand. Any other thoughts or comments on that?
So I think that if I wasn't a mother and if I was a male, I feel like I could have progressed more in my career. But I don't think I would change anything differently because I really enjoy my children and my family. So they were worth everything I gave up and had them. So I don't regret it. I don't think I would change it, because if I want to have a family and children, I would have to do that. And I wouldn't be satisfied if I didn't contribute to their growth and their development. So I don't think I would change it. I just have to work harder now at my older age. That's all.
No, just more experience, not older. It's any other thoughts or comments on that one? Okay, and I think there is someone commented, about a point. Would you change your mentors, or do you stick with one mentor, or would you recommend changing mentors over time? Any thoughts on that?
So actually, I put that, Andrea. I just wanted to say that I've had male mentors. My chair was a male mentor. He was a great mentor to me, but he was a workaholic. He used to work 24/7. And all he thought about how many papers he could publish, and he has a CV that's thick like a book. And I would go into his office as a fellow, and he would start talking about my research project, another paper he wanted to write, and I would say to him, Dr. Rees, how's your family? How's your daughter? And he would turn around and tell me what a great pianist he was and how he hadn't been there for this. And I said, don't you think it's a great idea for you to go visit him? And I think I brought a little humanism out on him. And I think he started considering it a little okay. It's okay to go to his kids' recitals, and not just his wife. He admitted his wife took care of everything and did everything, but just to, it was okay for him to take time out for his family and spend time with them, and stuff like that. I think we as women can be mentors, not only for other women, but also for men.
Now, that's actually a really terrific point. So a mentor-mentee relationship is really bi-directional. So it's not just all the benefit to the mentee. It's clearly, in your case, was benefit to the mentor there also. No, terrific point on that. I don't think there's any other questions in the chat right now, but let me ask, this is just something we had talked about when we were creating this panel topic, and we said work-life balance, and so we always think of a scale that's even on both sides, right? And the weights are equal. So is that reality, or are there different priorities at different points in time? And if you had to rename this session, what would you do to rename it? Start from whoever wants to start, or anyone. If I could just hear from the panelists, what would you think?
Let's start with Lisa.
Yeah, I'm happy to talk about that. So I have given up on the concept of work-life balance. I think it puts too much pressure on us trying to think that you have to be perfect in both aspects. And it's really hard trying to juggle and think, okay, I have to be there for, every event that my child is, or I'm going to miss out at something at work if I am there. And if you're at work, am I missing out? And I think I have to really try, and I'm not there yet, but working at developing harmony between my work and life. And I think of it that way, that I should be working towards work-life harmony, where I don't feel like one is taken away for the other, but they're both enhancing, and they can work together to make me a better physician and a better mother. And so I'm working to make that a harmonious situation. It's a work in progress. But I think a lot of it is letting go of mom guilt. There are other working moms who don't make every event. Yes, I get to be the default mom, and I get those. I used to get those mother's tea invitations. Those are the only ones I felt like I absolutely had to make. But some other things I realized, it's okay if I didn't make every single sporting event, but that I was there at the ones that counted. And then at the same time, that I could still build my practice and not feel like I was giving up, advancing career-wise. So it's a work in progress, but I do think it puts a lot of pressure on us thinking that you have to be perfect in both. But if you can find a way to make them work to make you the best person that you could be, you'll give the most of you, I think, to both areas or both aspects of your life.
Great. So if you had to rename the session, would it be
work-life harmony?
Harmony. All right. I like that. Terrific. Other thoughts? I think Nika, you had brought up an interesting concept too when you mentioned. What were your thoughts? Any other ideas, or any other ideas for a renaming of the topic today?
Yeah, my thought was sort of work-life flow. Flow to me is, it's like water. I mean, one time it flows more in one direction, one time it flows more in the other direction, and there's really, it just depends on the time. And so it's just sort of getting comfortable with it being a flow, and not necessarily, one balance or one set way, essentially.
So along with that concept of things changing over time and adjusting, and I think actually everyone on the panel has been really great to show, hey, you go with the flow, you adjust, you're really resilient. I think everyone on the panel has been resilient in many ways here. Any other thoughts on that topic?
I think we were saying in an email, right, the work-life pendulum, which is similar to the flow. And if you see it any other way as a working mother, I think you're going to have a lot of heartache, because you could have, sort of top of your game day at work. You did everything right. You caught a diagnosis everyone else missed. You gave an incredible lecture. Everything was wonderful. And then you come home and you check your email, and you get an email from the kindergartner teacher saying that your child doesn't know how to draw yet and keeps drawing hands coming out of your child's head, coming out of a head. That's a true story. Was that we got this feedback that our 5-year-old is not progressing in art because he keeps drawing the arms coming out of the head. And you say, oh my God, I haven't spent enough time. I haven't done art with him. I'm a failure. And you can so easily pull away all those accomplishments in your career because you hyper focus on the one mini failure, as a parent, which in reality is not really a failure, right? So I think that letting that pendulum swing and not being hyper focused, and maybe talking to other people, and really honestly, like incorporating your partner to say, this is if we're having an issue, with our kindergartner, improperly drawing human beings, let's figure out how to work together to figure out, and having like that shared responsibility. And not everyone has that opportunity, because like I said, being a single parent, I can't even imagine. But yeah, like not hyper focusing on the failures, but sort of focusing on what you did well, and putting it all into perspective. It's really hard to do. It's,
That's great example. See, I would have just thought he was just an abstract artist. I mean, that,
I can tell you, we basically ignored that feedback. And I'm proud to say he is currently drawing necks, and he has arms coming out of the torso. So it took a year, but we were able to get that.
So great accomplishments.
I have to tell you, Joanne.
What's
Joanne,
that?
I had the same experience. They called me and told me my son was still drawing stick figures, and he was in first grade. And my husband said, well, I'm 35. I still draw stick figures. So I don't know what the problem with that is. It's a different perspective.
Right, there is. And
I think the other thing you do in this is you really, at least in my household, we had a strong division of labor. So all their events my husband went to. He never missed any events. So I got on the weekends. He went to all their events so I could catch up on the housework and the grocery shopping and all of that. So we had a very strong division of the things that my husband did and things that I did. And of course, if we had time, we would meet up and do, but you have to have a support and a system that works for you.
Yeah, no, that's the key here, right? Different supports, different people. It could be a nanny, it could be, a spouse or others. That's a great thought. So I know we can't really poll, I don't think, but if you have, and I don't know if people could write in the chat or they could give us a general idea. If you had a vote, well, how would you rename this? Would it be number one would be work-life pendulum, swinging back and forth at different points in time. Number two would be work-life harmony. And the third one I think I heard was work-life flow. So one is pendulum, two is harmony, and three is flow. I don't know if people could put something in the chat. Pendulum, there's a vote for pendulum. And some other ideas, harmony. So a couple of harmonies, and so harmony is kind of nice and calm and settled. I like that also.
We also have work-life juggle.
Someone wrote juggle. I like that, work-life juggle, and that's what it sometimes sees. Multitasking and juggling things. I like that also. Very, very good. That was Nicole. Thank you. So yeah, this was great. And so this is great, and we could do even better than that. I agree. So just before closing, I would want to say, does anyone have any last remarks or comments or pearls you'd like to say to the group? Anything in particular?
Andrea, there's a question from Jocelyn.
Okay. I have never felt pressure from my significant other. It was the opposite. He has been my greatest supporter. And Jocelyn, thank you for saying that. And I actually feel the same way. And for me, I could not have done my job without my from my significant other. My partner is, my husband has been great too. So, but everyone, has different ways of doing that. So it's not division of labor. And
Andrea, I think she was asking, her question was, does anyone get pressure from their significant other to spend less time at work and more time at home? And I had actually responded by, my answer is no. It's the opposite. And in fact, one of the issues I think women have is that they may not say no, right? They feel like they have to do everything. My husband is really good at just saying, why are you not outsourcing that? Why are you folding laundry at, 12 o'clock at night? Like, let's figure out ways to make this easier for you. So for me, the answer is I would never be able to do it without him. And he's been great.
It's great. So that actually, and so we do, and I'm so happy to hear. Actually, it's not all women, and I can't see all the attendees, but Dr. Goodman, thank you very much. Division of labor is important, and that's key. There's a division of labor. It's a team, right? It's a team at work, a team at home. And let's see, there's one other thing here, any words of advice to someone in mid-career. So this is a little different stage. Any words of advice?
I think this is Maritza, certainly midlife career. I really believe that the harmony concept is huge. I really think that we have to learn how to become comfortable with ourselves, and that's an evolving process, whether it's in our field of interest or whether it's at home. It takes time for you to develop the balance. In the beginning, it's probably a little overwhelming. And then as your support system grows and as you mature within your career, you become more comfortable with it. So it just takes time, and you just have to allow yourself time. And as Joanne said, I think we have to accept, what happens. We have to accept it and not be so critical of ourselves, because that's easy to do. I think we are sometimes our worst advocates. So I think if we, allow time and utilize the support network if necessary, things like that, use our resources mostly, we get through it.
I would like to underscore what Maritza said. I think the key here, what I hear Maritza saying is, you need to figure out what makes you happy and what you want. And I think that's what you want to go after. So if you figure out it's your family you want or your work, and you can have both, you just may not be as fast in getting there, but you will get there. So I think you have to figure out what you really want, and that's going to be really, really important, because that's what's going to give you inner happiness in the long term. The second point I would like to make is there are families out there and relationships where, and more likely in partners who are not in medicine, they want you to spend more time at home. And there are families who will feel that pressure. And I think bringing spouse to work or children to work, these kind of things are important in that case. A lot of times people don't understand what you're doing. And I think a lot of conversation can be very helpful in those cases. That's all I have to say. Maritza, I look up to you. Thank you.
That's fabulous. Fabulous.
If I could add one thing about the specific question about career, I think it's actually a good time to reevaluate. And I think some of this may have been said, by Mina and Maritza, but it's a time maybe to think that what you started off thinking was important initially may be different for you now. Your priorities might have changed. And, most of us get focused on is academic in a traditional sense, in this research oriented track, but that may not be for everyone. And there are more clinical oriented ways to advance, and people sometimes go into teaching and find that education may be another track that's important for them. So it's a time to think, okay, when I started out in my practice, I may have thought one way, this is what I wanted to do, but sometimes it's okay to stop, especially mid-career, and rethink, what do I really want? What have I really found joy with? And what's really, helped me to become the person I am? And is there another way going forward? Does my future actually look a little different than how I'd initially imagined it? And it's okay at midpoint to think, to stop and reassess and see where you are and where you want to be.
And that's great advice. So your initial path doesn't have to be the final path, and your wants and desires and others around you may make that change over time. So don't be worried about changing paths. No, that's fabulous. So, I really want to, thank, I think this was terrific. I'd like to thank everyone here today, your willingness and really to share your personal experiences, your personal challenges, and really allowing us all to learn. I've learned from everyone here today. It's really been great. I've really enjoyed talking with everyone. Thank you for the audience in particular for joining us today. It's been a great turnout, and really just your joining here today is really for your support of women in medicine. I hope you enjoyed it as much as I did, and thank you for Cooper for allowing us to put this together today. Have a great one.
Thanks.
Thank you.
Thank you.
Thank you.
Thank you, Andrea, for moderating. That was great.
Yes.
So,